Hello, good morning friends. Myself Dr. Rajal Shah and I welcome you on behalf of HMI Ahmedabad unit. So generally we meet with specific topic and discuss on it, but today it's great honor that I have a great fraternity of homeopathy from Hyderabad, and sir is very well renowned, has awarded with the best teachers award and former principal of Jai Surya Homeopathic Medical College, Hyderabad. So he is here with us in Ahmedabad, and it's a really honor, and I really feel overwhelmed to welcome you, sir, Dr.S.PaveenKumar, sir.
Thank you.
So list is endless that he has done so many research in HIV and AIDS, and he is practicing since long and seeing heavy OPD and all that. We'll talk about it, know about him in between, but let me grab the opportunity and we'll start without wasting a minute. So I would like to ask that generally after BHMS, when we start our practice, we first took thorough consultation and then repertorization and find any medicine. It takes a little time. It's time consuming process to find a right remedy. But as I know that, sir, you are seeing lots of patients in a day only, and so I want to know, and especially for the beginners, the crisp tips that how we diagnose the disease or what to look in patient and how to reach the medicines.
Yes, thank you.
Yes.
Good morning, all of you. Actually, I tell you,
Yes.
for anybody's clinical practice, there is a first day, beginning day.
Okay.
So nobody will become an expert on the very first day.
Yes.
But what we should do from the beginning to become expert, I don't mean to say that I am an expert. I still find a lot of problems. Dr. M.L. Taylor in her drug pictures quotes that there are three types of prescribers in homeopathy. One scientific, two artistic, three intuitive. Scientific is that where most of us would do, or all of us do, maximum number, where we take the case, erect the totality, then select the rubrics, and then repertorize, and we see the list of the drugs, and mostly 1, 2, 3 we will select among these three drugs and prescribe. Commonly the patient is relieved. We are happy, patient is happy.
Yes.
It goes on. But we would find it difficult in certain cases wherein in spite of doing all this for a period of time, the patient is not relieved. Why? So we will wonder, where is it going wrong? I've taken the case meticulously, I have erected the totality, I have repertorized, but why there is a problem? Now then I will introspect myself, review the case and understand I missed this important characteristic feature, this causative factor, this particular mental symptom somewhere. So what I did, like in the disguise of making a totality, I have put everything in line and I have given equal importance, maybe little more, little less, but I have not taken the whole characteristic feature of an individual into special cognizance, and I have not selected a right remedy at that time. So then I will understand, realize, it is not just this. There are certain things beyond. If a patient comes, I should ask and see, get the whole case, and then it is not the quantitative totality, it is the qualitative totality of symptoms.
Okay.
So it is not 10 symptoms, 15 symptoms. If you take any case of, like once my PG student took the case and there were 38 mental generals in a patient.
Okay.
This is also one-sided according to Hahnemann. Maze of symptoms. So it will be very difficult.
Yes.
Every symptom is higher in its mental general, first grade, second grade, third grade.
Mostly polygrades.
38, then you will wonder. And I tell you, take it from me, the highest number of mental symptoms are there in which drug? Stramonium.
Stramonium, yeah. belladonna stomach.
648 or so, those mental symptoms are there in Metromedica pura itself. Forget about other authors' concepts.
Oh.
So, obviously, if you have so many symptoms, you will get stubborn on
Yes.
the higher pedestal. But all the patients are not stubborn.
Actually, yes, sir.
So, you will find it difficult. Then you will learn from that stage. So, what is more important? What are the highest characteristic features, and how do we select? That is artistic. So, we learn the art of prescription.
Okay.
We take some changes and then do it.
But we have to pass from this phase.
First, you should definitely be a scientific prescriber to reach the stage of artistic prescriber.
Yes.
We should not be in a hurry. Let us learn the fundamentals first and then go.
Yes.
You will learn in your own journey. Second, the third one is intuitive. She writes beautifully, Emil Tyler. Knowledge coupled with experience will make you become intuitive prescription. Of course, माँ सरस्वती का दया भी रहना चाहिए, तभी आपका वो जो आप सोचते हैं,
what we pursue, that only we give.
When we see the patient, yesterday, if you recollect, in our GHF conference,
yes,
I told Mr. Dangayach, the man who led us from the front in the success of this conference, Bhaskar Bhai, all HMI people, everybody, but he led us from the front. His constitution is typical Nakswamika. So when you look at him, interacting with him 1 or 2 days or something like, you will understand with your little knowledge and experience, he is Nakswamika. Then you will be careful. You won't confront with him.
Yes.
Because
Nakswamika in our daily life even.
Exactly. The Nakswamika cannot bear the contradiction.
Yes.
So this is a glimpse of intuitive prescription. I am not well versed with it.
Yes, yes.
So there are so many great people like my Guru Dr. G. Janardhan Reddy, my own Guru Dr. P. Nagabhushan. They were intuitive prescriptions. My Nagabhushan sir used to prescribe for 20 patients in an hour.
20 patients.
He never used to write a case sheet. Look at the patient, then he will remember that forever. That impeccable memory. It is, I already said, like Ma Saraswati ka den hai. But that intuitive prescription, hoping that we would reach that level, but we will reach from first floor to second floor to third floor. There is not a lift that it will take you straight onto third floor.
Yeah.
So these 3 types of prescriptions, if one keeps in mind, my young friends who have established their practice, who are going to establish their practice, be scientific.
Please
take the case carefully. Don't leave anything. And I tell you, Rajal, the most important thing in any homeopathic doctor's case taking is lending the ears, listening to the patient carefully, patiently. Don't jump to conclusion.
Yes.
And most of the patients won't reveal the characteristic features immediately.
Yes.
And they would probably reveal later when you probe. Because mind well, the characteristic feature is unique and it is not seen in other patients. So he would think, when nobody is suffering, why should I mention this?
Yes, that's the point I supposed to ask.
Yes, they will all stress upon common symptoms.
Yes.
And we can't prescribe a correct remedy basing on common symptoms.
So sir has beautifully mentioned that there are 3 different ways which you cross by the time and experience, but the foremost important is thorough case taking. And there is nothing like that what we have done in exam, that we are finding or we are seeking the same symptoms from the patient, but we have to summarize, go step by step. Is a time consuming process, but by the time we will understand, we realize that what is the important. And many times we will get history not in a first consultation.
Yes, absolutely.
By the time
I tell you, Rajal, the point is like initially we have enough time, less patience. This is the golden time.
Okay.
Whoever comes 1, 2 patients, spend more time with them.
Okay.
Because patient is your guide.
Yes.
patient will tell you so many things which you would not have heard from your teacher nor learned from a
Yes,
book.
practically.
Patient is unique.
Yes.
As Hanuman rightly writes, every patient is unique.
Yes.
No stereotype.
No.
So don't expect that the fellow who fell on the ground, he would complain of same arnica type of pain.
No, no.
He may not.
Yes.
So don't expect. So listen to the patient carefully, take the whole case, then probe little, then examine. Don't forget to examine the patient.
Yes.
Don't take everything for granted.
Okay.
And physical examination is compulsory.
Okay, it's
And
a part of
mental
case
evaluation.
history, right, sir?
Every case. And always remember, we need to write the cases. For me, for example, I had the privilege of working under Dr. Nagarshams, who never wrote a single case sheet in his lifetime, and he never required at all. If he sees you today, after 17 years, 20 years, you come back, he will tell you your name,
Oh
he
my
will
God.
tell you your drug, what drug he has given.
How can this possible? Yeah.
This I have experienced for 4 years, I can tell you.
You are lucky in a way, sir, that
Absolutely fortunate, भगवान की दया है.
आपने
So,
पूरा
but
pick भी किया.
I never felt that I should mimic him in not writing the cases, because it is none of my business. I cannot. It is not my cup of tea. I have to write down the cases.
Yes.
So when I was struggling in initial days, he said, "Okay, for your sake, you write down."
Yes.
So I used to sit in front of him, and the patient, whatever he narrates, I used to write. Probably that is one of the main reasons for me to dwell more on keynote type of prescription.
Okay.
So because the patient is allowed only 2-3 minutes. When once we never used to ask a question. You come as a patient and you tell your symptoms in something 2-3 minutes, and his prescription is given straight away.
In 2-3 minutes, you just supposed to write.
He write. I have to write down all those characteristic features explained by the patient, which include even the common symptoms.
Yes.
And then
you have to.
I have to see why he gave that medicine.
Okay.
So that is how I'll give you one example here. I think all my friends would enjoy.
Yes.
One patient came when 15 years, for 15 days he went on vacation. My Guruji, Dr. Nagarshams.
Okay.
So I was in his seat and I was on cloud 9. My God, sitting in the seat of Dr. Nagarshams. One patient, unfortunately, he came. So he came for the first time. And do you know what was his symptom? Profuse salivation, as described in Kent's Materia Medica. It was wetting the pillow, it was leaking, especially more in the night. What drug do you give? Merxol. I gave Merxol. He would be alright. But I was so anxious. It should be cured before my sir comes. So I told him, you come back in 3 days. Tell me.
Yes, okay.
Came back. No change, sir.
Achha.
I can think of giving a higher potency, highest potency, or LM
because
potency.
we were sure about medicine.
Not well versed with LM potency.
Achha.
So then what do? I was anxious because my sir would come back. I should do something to this.
Yes.
So I've seen all that and I gave lysine, hydrocodone, 1 year. Then said, please come back to me after 3 days. He came back and told, no change.
No change.
I have only now one chance before sir comes. Then, hey Bhagwan, कुछ तो help करो. So immediately I gave Kali Bicromica.
On which basis?
Saliva. That is there, but here it doesn't fit at all. I knew it, but I didn't have time.
Yes.
So I gave, and he came back.
Okay.
My sir also came back by that time. So sir sat. He said, "Sir, I came. Your son has given some 3 drugs, and I am not well, sir." So I felt completely insulted. But I was curious, what drug would he give? And before that, he would ask me, what drugs did I give?
Okay.
And do you know what is the wonderful thing? He never asked me. He wrote the drug and gave it to him. He came back after a week. पूरा ड्राई हो गया सर, आप महान हैं. पाँव छोटे छोटे. Can you imagine what was the drug?
No.
Nobody can ever imagine.
So at
And
least
in
sir
fact, I
has,
took
your
the
sir
help
has.
of Dr. Ines Prashant, who was close to us. He was my teacher.
Huh.
He died. He was a principal also. So he was professor. Then I asked him, sir, Sir gave this remedy, and where is it mentioned?
Right.
It is there in Dunham's Science of Therapeutics under Bryonia. Bryonia was given.
Bryonia, generally we think about the dryness and all that.
And it is there. People can read Dunham's Science of Therapeutics.
Dunham. Okay.
So this is what, like, these people, we were fortunate. All of you may not be fortunate. You may not be trained by Dr. Bhaskar like people and all that, because they also have their limitations. But my word, suggestion to all my younger friends especially,
Yes, sir.
that follow the rules, principles laid down in Organon meticulously. No need to follow anything else. All cults, all schools, you can learn later. I'm not against them, but they are not ultimate.
Yes.
But follow only Organon meticulously. Take the case completely. Then, if you are well versed with the Mater Medica, prescribe straight away. Otherwise, your crown will never fall down. Take the help of repertory. Come to conclusion of a remedy. Prescribe. Before you prescribe, try to check 2 or 3 characteristic features in the Mater Medica. Are they represented properly in this drug?
Yes.
Then you may not go wrong. I cannot say you will not go wrong. It depends on several other
Most of
factors.
times, because
Most
we
of the
have
time,
thorough.
you will be successful. At the same time, even if you go wrong, you know where did you go wrong. Then at least you can correct.
Right.
If you do it empirically, there is no way you can correct it.
And there is nothing like shortcut that every time we will like initial days we have to struggle. And sir has even done, sir is guiding us very crisp way, but the basic is we have to follow our Gita, Organon, and absolutely match it with repertory, materia medica, and Stallworks experience and all that. So, but still I want to know little more deeper regarding with the examples even, because many times if we follow some one school, then we follow that and miss many points and all that. So, for the beginners, practitioners, if they get a failure or no result in some case, then how to come back again? That is linked.
Yes, absolutely. All of you, please listen.
Yes.
WHO has conducted an international survey in which it is mentioned no doctor has got more than 66.37% success rate.
Okay. WHO
in the whole world.
Okay.
So if somebody says I have seen 100 cases and I have cured 100 cases, give discount of 33%.
Okay.
Right? That is number one. So failures are bound to happen to everybody. You ask Bhaskar Bhai how many times did he fail? Did he fail? Everybody. You ask any senior man.
Yes.
They would confess. Ye Bhagwan, ye kya hua?
So don't left homeopathic practice.
Absolutely, don't think that you will be successful in 100% cases. But at the same time, don't start with a negative attitude. You have to be successful in this. So for that purpose, when we are trying to do that, what we need to do is like, even if there is a failure, doesn't matter. Doesn't matter. As you have asked 2 questions. One, if you are failed or did not get a success in a case, what to do? Review the case. Probably, mostly, we have gone wrong somewhere in listening to the patient. I will give you a case. One lady of 43 years or 44 years came to me with severe menorrhagia, diagnosed as dysfunctional uterine bleeding. There were no pathological indications. She was having bleeding only.
No fibro, nothing.
She was a typical calcarea constitution. I have a fascination to fix up physical, mental constitutions. I may fail 100 times, but yet 101 I will try. So in that case, I have taken the case, and she was already treated by 2 of my gurus, and 3 gynecologists have advised hysterectomy.
Okay.
So then I gave the medicine. Calcarea carb 0/1. My gurus don't use LM potency, and at least in 75% of cases I use LM potency.
That's
so
the
I gave calcarea carb LM potency, thinking she will be alright. Next day evening she came, no change. my ego already hurt. What I was thinking, with this many years of experience, my drug prescription would be 100% correct. So I thought, okay, 0/3.
Okay.
Next day, no change. Then I thought there is something wrong. We are missing somewhere. So I sat with her. What is the greatest problem? As I already started in the beginning with one statement, stating that my young friends, they will have lot of time, less number of patients.
Yes.
Now, for us senior doctors, lot of patients, less time.
Yes.
So we have to adjust somewhere, the balance. With this patient, I told, I'll sit with her. So I started reviewing, asking questions. कहाँ हुआ, क्या हुआ? Then I told you everything. मैं सब कुछ बोल रही है, सब कुछ हो गया.
Yes, many times this happens. Patient भी बोल देते, सब बोल दिया है.
इसमें क्या है? नहीं, you are missing somewhere. क्या होता है? फिर एक बार बताओ, फिर एक बार बताओ. तो ऐसे तो बोले, Doctor, I think if you are asking so much, I don't use pads. When I said, come again, you are a lady bleeding so profusely, and you say you don't use pads. What is the matter? Do you use a cloth? No, not that way. I get bleeding only when I go to the toilet.
Okay.
Is it not
that is
characteristic?
Key point. Yes.
That is keynote. Immediately I searched in Robin Murphy repertory, which is on my table all the time. I depend on that. It's easy for me now. So immediately searched it. Robin Murphy female chapter menses only when urinating. Only one drug. Animal proved it. Magnetus polus australis. That drug I keep giving it to ingrowing of toenails.
Sir, repeat the name.
Magnetus polus australis. Animal proved 3 magnets. This is one among them. Animal proved.
Okay.
So that drug I have in my chest.
This is something, sir, sorry interrupt you. Characteristic when going to toilet only. Otherwise, flow in the night only.
Menses only when urinating is the rubric.
Okay. So that is more.
Only when urinating. Right?
Right.
So give it. I was anxious. 1 dose. SL 8 doses. Tell me tomorrow. She gave me a ring in the morning, 11 o'clock. I was in the class. I had said, sir, please underline the drug. Since morning, I went to the toilet 3 times. There was no bleeding.
Oh, great.
So this is key.
Very nice.
This is characteristic feature. But here that is not great. What is great? Probe, listen, review. If you have failed in first prescription, later prescription, no. Find it.
Yes. So as
you
well
will
said.
Definitely get the way.
Yes.
All that what we did was, as I already told you, patient does not think this as characteristic because मैं pad use करूँ या ना करूँ, इनको क्या बोलना है?
सही है.
Who will tell that? But when I was probing, फिर बोलो, फिर तंग कर दिए, तो बोले अरे यार कुछ तो बोलना है. जब वो बोली है, हो गया.
So friends, this is very beautiful crisp point. Like अगर हमें लगता है कि medicine is not giving result, so we have to work because homeopathy never fails. The homeopath has to work hard. We fail
umpteen number of times.
Yes.
We don't. I will give you one more example where we usually fail and how we intelligently correct. I'm not claiming that I'm intelligent, but little.
Please, sir.
So my father-in-law was chief engineer and his subordinate superintending engineer, a lady, Muslim lady, her daughter was suffering with fever for the past 3 months.
3 months.
Then admission, prescription, fever hospital director, that superintendent was treating none other than that great man. And he prescribed one anti-typhoid, anti-malarial. They have that. There is one word called as therapeutic diagnosis. If you give a drug and the patient's condition improves, you revert and say, because this drug cured, like anti-malarial cured fever, so it is malaria, even if the tests become negative.
Yes, negative, right.
So she was given even anti-cox treatment, waited for 3 weeks to see, no change.
Okay.
They were even suspecting there may be some cancer, some problem, infectious mononuclear, all the investigations were done.
And all the treatment based
Everything was normal and all allopathic types of prescriptions, whatever is indicated, whatever was indicated, it was done. Then my father-in-law told, why don't you go to Dr. So then she realized, Arya, he is there. So she came. I took the whole case. And I thought, spoiled even. Whatever it was, a little intermittent fever, they have spoiled it. So allopathic drugs spoiling the case of intermittent fever. Arsenicum is the drug. I gave arsenic as 0/1.
To clear the case.
To clear, to make her comfortable. First I have to enter into the case.
Yes.
So I gave arsenic 0/1. She was very curious. She gave a ring and said, sir, fever has not come down. Then I said, okay, arsenic 0/3. Second day she informed, sir, it has not come down. Then I said, will you do one thing for me, Mrs. Nazreen Qadiriji? Will you do one favor for me? I said, what? For 3 days, 72 hours, don't give any medicine, including my placebo. मेरे बच्चे मर जाएंगे. मैं बोला 3 महीने से बुखार है, कोई दवा काम नहीं कर रहे, मरे नहीं.
तो 3
दिन में कहाँ मरेगी?
Yes.
So right, very good. So
this is even important to convince the patient and decide how to.
She said reluctantly she agreed. आप बोल रहे तो ठीक है, मैं मानता हूँ. सी साहब के दामाद है, आपको ये कुछ बोल के डर से मान लिए. I told her not to give even a single drug, including paracetamol.
Okay, please, yeah.
My father-in-law requested, why don't you give placebo? At least there will be satisfaction. I said no. No means no. Pink movie, Amitabh Bachchan. No.
Oh no, how you decide, sir? But this no placebo even.
No. I understood because I am a medicine teacher, so I thought yes, it could be. Because mind well, the case was not getting solved for the past 3 months.
Yes.
2 days over, 3rd day morning she gave a ring. आपको स्वीट कौन सा पसंद है?
अच्छा,
क्यों, क्या हुआ? मेरे बेटे को सुबह से बुखार ही नहीं है.
Okay.
You read in Harrison's internal medicine, this is called as aseptic fever, which is commonly maintained by antibiotics.
Okay.
Stop the medicine, patient is
great.
Now all the investigations are normal. Patient is not deteriorating. 3 months she has been suffering.
Okay.
And so-called my great remedy arsenicum alone, for which I am so favorite. My missus used to tease me. If ever I know any drug in Metramedica, it's only arsenic. Even that I don't know anyway. So then I decided it is aseptic fever. She became all. Now what do we learn from this case? We have to be careful even in diagnosis. We have to be cautious, understand the prognosis, see the course of the case, improvement. Not to give medicine is highly difficult than to give the medicine. According to Dr. G.H. our guru, another great doyen of homeopathy in Hyderabad. He is no more anyway. So, like our hands each all the time. ये दे दो, ये दे दो, ये दे दो, 4 दो, 5 दो, 6 दो. दवा का एक लिस्ट लाइन और पीटीओ लगा के और एक बार. तो no need.
So this is very beautiful aspect. Actually, we have to look inside this point even that find out the causation. That every time we collect the symptoms. Yes. So actually very beautifully you have explained all the crisp session and the points. So it may be very useful for our beginners and all. So friends, let me know what else, because this endless and sir having a very less time. Actually, then let me know in comment box if we have to set another session with the sir. So we'll set according. Oh, I have to comment. Okay, my pleasure. I'll try, sir. We'll see.
You'll be my guest. Please come down.
Yeah, please. But actually, thank you for this session, sir. You have give me and our viewers a great insight, new views, ideas how to go and how to stick to homeopathy, because homeopathy never fails, friends. So this is our legend doctor, and we are getting more.
Before I take leave of you, my friends.
Yes.
Ramakrishna Paramahamsa once told very beautifully, confidence is life, doubt is death. Don't doubt yourself. Don't doubt your system. Don't doubt your medicine.
Perfect.
Have confidence you will be successful.
Yes, actually, sir is national and international speaker. He is associated editor of National Journal of Homeopathy. Friends, it's a very good magazine, and you are getting update with that even. And co-author of the revised Ellen's keynote. So many more I wish to come in future with the sir also. So friends, let us to know, like, share, and get to know the new ideas with the sir. Thank you so much.
Thank you.